Pregnancy occurs when a sperm fertilizes an egg after it's released from the ovary during ovulation. The fertilized egg then travels down into the uterus, where implantation occurs. A successful implantation results in pregnancy. On average, a full-term pregnancy lasts 40 weeks. Many factors can affect a pregnancy. Women who receive an early pregnancy diagnosis and prenatal care are more likely to experience a healthy pregnancy and give birth to a healthy baby. Knowing what to expect during the full pregnancy term is important for monitoring your health and the health of the baby. If you'd like to prevent pregnancy, there are also effective forms of birth control you should keep in mind. A missed period is one of the earliest symptoms of pregnancy. However, a missed period doesn't necessarily mean you're pregnant, especially if your cycle tends to be irregular. Headaches are common in early pregnancy. They're usually caused by altered hormone levels and increased blood volume. Contact your doctor if your headaches don't go away or are especially painful. Some women may experience light bleeding and spotting in early pregnancy. This bleeding is most often the result of implantation. Implantation usually occurs 1 to 2 weeks after fertilization. You can expect to gain between 1 and 4 pounds in your first few months of pregnancy. Weight gain becomes more noticeable toward the beginning of your second trimester. High blood pressure, or hypertension, sometimes develops during pregnancy. Several factors can increase your risk, including being overweight or obese, smoking, having a prior history or a family history of pregnancy-induced hypertension. As your uterus muscles begin to stretch and expand, you may feel a pulling sensation that resembles menstrual cramps. If spotting or bleeding occurs alongside your cramps, it could signal a miscarriage or an ectopic pregnancy. Pregnant women have an increased risk of anemia, which causes symptoms such as lightheadedness and dizziness. The condition can lead to premature birth and low birth weight. Prenatal care usually involves screening for anemia. Breast changes are one of the first noticeable signs of pregnancy. Even before you're far enough along for a positive test, your breast may begin to feel tender, swollen, and generally heavy or full. Your nipples may also become larger and more sensitive, and the areolae may darken. Vomiting is a component of morning sickness, a common symptom that usually appears within the first 4 months. Morning sickness is often the first sign that you're pregnant. Increased hormones during early pregnancy are the main cause. While pregnancy is usually a happy time, it can also be a source of stress. A new baby means big changes to your body, your personal relationships, and even your finances. There have also some symptoms you should know about, like heartburn, diarrhea, acne, insomnia, constipation, back pain, depression, which is usually happening during pregnancy. If you think you may be pregnant, you shouldn't rely solely on these signs and symptoms for confirmation. Taking a home pregnancy test or seeing your doctor for lab testing can confirm a possible pregnancy.